Thanks. Thanks, Dr. Young.
So excellent news overnight. All of our cases were in quarantine during their entire infectious period. So that one person who returned from the Philippines and went into hotel quarantine tested positive, so we're all used to that. And then our 4 community-acquired cases related to the Indooroopilly cluster who were all in home quarantine during their infectious period. One of those, so I'll go through those 4 cases. One of those is a staff member at the Ironside school, so we're still seeing first-generation cases. We all have to remember that the incubation period is 14 days, so it's really important that people, all of those 12,000 people, do stay and adhere to that quarantine as we go forwards. Then one was a parent related to a child who attends Ironside. Another is a household contact of someone who attends Brisbane Boys Grammar School. And the 4th is another household contact of someone who attends Ironside. But the important thing to note is that the incubation period is 14 days. And unfortunately, that means that anyone who's in home quarantine, if they become positive, that entire household then has to remain in quarantine for another 14 days. So this is a lengthy process that we all have to work together to get through. Now, there are some... Oops, I'm losing my... Right, I won't touch it. There are some... There have been some questions, I'll put it that way, raised about community support. Now, it's really important for the next 2 weeks that people do what they did over those 8 days. So just think, is this really necessary? So if you're questioning whether you can do something, then probably you can't. So for community sport, it is fine for up to 10 people to gather in a public place, but you must wear your masks, you must keep social distance, and you can't come into contact with people. That's really, really important. So if your sport is one that involves contact with other people, then it can't go ahead. But if it's golf or tennis and you've got a small group and you maintain that social distance and you wear your masks unless you're strenuously exercising, then it's fine to go ahead. And the same with indoors. If it's a dance class and there's no contact between the dancers and there's one person, maximum one person per 4 square metres, that's fine. So, and then people have asked about bridge. Well, the same thing. If you've got, you can have up to 10 people in your home. We know that. Or if you're going to a commercial venue, you can have one person per 4 square metres. So people have done this so well, and I'm sure they can sort out going forward what they can do in terms of community sport. What I don't want to see is kids from a whole lot of different schools all coming together, because we know that that led to a significant part of this most recent outbreak that we're still working through. We had that karate class, for instance. So it's really important that people use their common sense, as they've done so beautifully over the last 8 days. And this is for the next 2 weeks, while we just make sure that we don't have any cases that are out and about in the community, because we're only just started to have those days of 0 cases infectious in the community. That's really important for South East Queensland. Then for Cairns, it's vital that you are now in lockdown for 3 days while we work out all the contacts of this taxi driver and we go back and reassess all the contacts of that pilot who brings ships in through the reef. So clearly we've found on whole genome sequencing that the taxi driver acquired it from that pilot. We suspect it was when he drove that pilot from his home to the airport and that pilot then flew down to Brisbane. So we're just going back and checking all of those contacts and just making sure that we have all of them. So it's really, really important that people in Cairns, any symptoms at all, don't wait for a call from Queensland Health, just come forward and get tested. And the numbers yesterday were magnificent. People did exactly that. So thank you very much. It's really important going forward so we can find if there's any other clusters of cases or any other chains of transmission so we can manage them as quickly as possible. Then down in the Gold Coast, we do have that one case down there who did test positive. So for the Gold Coast, it's really important that you also, any symptoms at all, please, anywhere in the Gold Coast, come forward and get tested. And that's really important to do today as we just work through what the risks are from that particular individual who came forward so quickly to get tested. So all of those things just need sorting, but the general message, of course, remains the same. It doesn't matter where you are in Queensland. We have no idea where this virus is next going to pop up. So please, any symptoms at all, don't think it's your normal hay fever or normal whatever, just come forward and get tested. So we had 26,000 people do that yesterday. Earlier last week we had over 50,000 people. So please, it's really important we continue those numbers. Thank you.